Welcome to the Neurosurgeon's Journey, part of the library of Brain and Spine Group's Medical Student Neurosurgery Training Center and a collaboration with the AANS's Young Neurosurgeons Committee. I'm your co-host, Michael Kortz. I'm currently the Senior Student Director of Education Resources for MSNTC, and shortly we'll be joined by your other co-host, Dr. Jeremiah Johnson. He is an Assistant Professor of Neurosurgery at the Baylor College of Medicine and is the current chair of the YNC. We're happy to have you with us as we look deeper into the rewarding life of a neurosurgeon and explore what it takes to get there. Welcome back to the Neurosurgeon's Journey podcast. Dr. Johnson, how are you today?
Doing pretty good, Michael. How about you?
I'm doing very well. Thank you. Quick update for our listeners. We are playing around with the frequency of how often we want to publish episodes. So bear with us as we become more consistent with that. Might be transitioning to a bi-weekly schedule, but hopefully we'll have that figured out soon. Now to the meat of the topic today. So we're discussing the MD-PhD pathway or pathways, research more generally, and anything else that our guests would want to discuss. We have two guests today. The first is Brandon Lucke-Wold. He's a PGY3 neurosurgery resident at the University of Florida. He earned his MD-PhD and master's degree in clinical and translational science at West Virginia University. He has published over 100 articles and book chapters and will be starting his Enfolded Endovascular Fellowship next year. He is the co-founder of two biotechnology companies, Right-Walled Scientific and Chronic Traumatic Encephalopathy Cure. Brandon, how are you?
I'm doing well. Thank you very much for having me today.
Absolutely. Thank you for coming on. Our second guest is Nwafor. He's a sixth-year MD-PhD student at West Virginia University and is originally from Nigeria. He is currently finishing up his PhD in neuroscience this coming April and is in the process of transitioning back to his clinical years. Divine is great. He also has an interest in endovascular neurosurgery and is a social media team leader for MSNTC, which we are very grateful to have his help here at the TNJ podcast. So Divine, thanks for being on.
Thank you.
So per the standard, Dr. Johnson, we always love for you to set the scene. You know, we've discussed in previous episodes why research is important in neurosurgery, but maybe just give a brief overview of the different ways to get that done, and then why a discussion of the nuances of an MD-PhD pathway might be important.
Yeah, no problem. So, I mean, I'd be very interested to hear the other guys' input on this as well. Obviously, that's why they're here. But from my perspective, you know, there's one of the engines that pushes innovation in our field is research, without question, and really in our world. And there's a method of thinking that can be taught formally through MD-PhD programs, or it can be acquired through experiences with people who are trained in that. And there's various ways to get that skill, and MD-PhD is one of them. So traditionally, MD-PhDs are a combined program in medical school that you can electively choose to go into when you apply to medical school. And it adds several years depending on your location and your mentors and your projects, et cetera, but several years, and the guys can get into more specifics about how that works to your medical school training. And then when you graduate, you have an MD and a PhD degree. There's a series of nuances as to whether that helps you or hinders you, et cetera, for the neurosurgery match process, as well as how that unfolds in your favor as a neurosurgery resident looking for jobs, for example. And some of that just has to do with what you would like for your future career to be. So it's a very valid pathway. Some of the real leaders in our field are MD PhDs that do cutting edge research. Some of their leaders in our field do cutting edge research that do not have PhDs. So there's a variety of ways to go about it. But it is a really interesting topic, and these guys would be very good resources to talk about some of the pluses and minuses and nuances of this.
Great, thanks. So you guys can correct me if I'm wrong, which I probably am, but there's three kind of rough ways to get a PhD along with your medical degree. So I think what most people think of is the Physician Scientist Training Program, or MSTP. I always forget what it's exactly called, through the NIH. And that's where you complete your PhD but in the middle of your medical training. So kind of like Divine is doing, he's finishing his PhD after his second year of medical school and then comes back 4 years or so later and then finishes out his medical school. People can also complete a PhD before they get to medical school, either because that was their primary focus in neuroscience or something else or a different career. or people can get it potentially in residency and beyond. Is that fair to say, Brandon? Is that kind of the three buckets that people can get a PhD?
Yes, that's fair to say. I would say traditionally the more like MSTP type route where it's done in between is probably the most common, but there are definitely like neurosurgeons that have gotten PhDs prior to going to medical school. There are some options to get it during residency. One of the MD PhDs that I worked with more in a private setting, he did his PhD during residency. So those are the three routes. But pretty much anybody that finds an interest at some point has options available to them.
That's great. Thanks. So let's stay on you, Brandon. I'd love to hear just your personal background, your story, why you settled on neurosurgery, and then, as a second part to that question, just, how that tied in with your decision to pursue and then complete the PhD.
So I actually decided on neurosurgery pretty early on. My uncle had a spine surgery after a spinal cord injury when I was 12. Sparked my interest. Nobody in my family was in medicine or had gone to college at that point. So I knew that there would be a long road ahead of me, but I had an early interest, started reading as much as I could. In selecting universities to go to, I decided to go to Baylor University because of the strong neuroscience, which I saw the mug there. And that's where I got exposed to my first research experience.
Stick and bears. I'm just going to throw that in there.
Stick and bears. But I had a great mentor there. I had no idea that MD-PhD programs even existed, but got exposed during my junior year of college and started looking into what it would take to get into programs. I tried to be as strategic as possible during my application process, really focusing on specific programs where I could train within a neurosurgery department, knowing that that was my ultimate goal. So that's ultimately what led me to WVU. Had a great mentor there, trained underneath the chairman. Had a lot of exposure to operative experience, to taking call with the residents. So really knew what I was getting myself into in terms of residency going forward. But overall, I had a great learning environment, and it fit exactly what I was looking for.
So how did you know that because you applied to the scientist training program, the MSTP, through before, as part of your medical school application. Am I correct there?
That is correct.
So how did you decide that you wanted to, do the 8 years instead of the 4? What kind of led you? Is it just your interest in neuroscience back in college that really kind of pushed you to that decision, or was there something else that factored in? Or
so there was a MSTP symposium that was hosted down at Baylor College of Medicine when I was entering my junior year of college. Really talked about the intricacies of what it entailed. There was a couple members of the neurosurgery team that came and talked at that symposium. So it really sparked my interest. Like I said, I had no exposure prior to that. And had been doing research, but not on a large scale. I knew I liked it. I wanted to incorporate that into my training. And so I started researching as much as I could, realizing that a lot of the leaders within neurosurgery were actually MD-PhD trained as well. So they really started the process of getting more excited about it, trying to push the field forward. And so I decided to apply pretty broadly. So I think I applied to 17 programs overall, had 11 different interviews, and it works a little bit different than normal medical school. Applications, state lines don't really matter as much. you are actually get multiple different offers at the same time, and then you're trying to pick and choose at that point. So I did a lot of second looks, and like I said, I chose to go to WVU because I could train underneath the chairman of neurosurgery there, who was also MD PhD trained himself.
There's a couple things I'd love to expand on, but I'd love to hear Divine compare and contrast his pathway a little bit. So you ended up at West Virginia as well. And also, especially you being in the unique position of almost finishing your PhD and transitioning back to your medical school curriculum. Is there anything you want to compare, contrast, expand on from what Brandon had talked about?
Yeah, so actually my path towards the MD-PhD program was very different from Brandon's. So my interest actually in neurosurgery itself actually stemmed from, I remember taking a class in this, I think this is called junior secondary. This was probably when I was 12, because I'm originally from Nigeria. And so, my teacher actually came in, we had a really bad grade that day. It was, the averages were not looking so good. And so, he was very disappointed in the class, and he was talking about, you guys need to do better. There's this brain surgeon in the US that's Ben Carson, and he didn't really know anything at this age. And he started going to the library and he was reading, and now he's a brain surgeon, and now he's, separating like conjoined twins and all this stuff. So I went up to my teacher after the class and I spoke with him, and I was like, hey, so you talked about this, he's brain surgeon. So he's like, oh, no, you don't have to worry. You did pretty well on the test. I was like, oh, I'm just interested in the book. I just want to get the book. And so I started reading the books, the Think Big book, because I always had an interest in medicine from a Red Cross perspective and first aid and all. But it was not until I started reading those books, I could actually just imagine myself, Dr. Carson doing the hemispherectomies and, doing some of the surgeries I had read. So that was like sort of my passion for that. And then after having this passion, I decided to come to the US to get a formal education year. And then I did a 2-month rotation in Cape Town, South Africa for neurosurgery. And that sort of even like engineered my passion for neurosurgery even more. And so when I actually applied to the MD PhD program, I actually applied as an MD only student. I had done research back in undergrad. I failed spectacularly at it. I worked with bots. So I did a lot of electrophys. Most of my data was very difficult to get from them. So you can see I had a little bit of discouragement in research, but I still had the passion for medicine. So I recall in my first year classes in medical school, we would talk about, the different diseases, stroke, Alzheimer's disease, and everything. And so as I would learn those, then I got more and more interested in research. So it was more so like medicine was a driving force for me to continue participating in research and realizing that, they go hand in hand. So then I started looking up projects and, looking at who I could talk to about research. And that's actually where I met Brandon. And Brandon was one of my mentors that even got me more interested in it. Then I met my current PI, Candace Brown, and she was doing fantastic stuff in all this, the neurological diseases that I was very much interested in, especially was looking at a lot of vascular abnormalities. So for me, I came in as this MD student, and I did a lateral transfer after my first year, as opposed to Brandon that sort of started right up from the bat as an MD PhD student.
Wow. So yeah, I guess you didn't have a very different pathway there. So I'm glad we have both of you guys on. So Divine, maybe do you want to give us the elevator pitch for your research interests and what you're looking at right now, your thesis, that sort of thing?
Yeah, absolutely. So my interest is mostly I look at a broad range of diseases, from sepsis to stroke to Alzheimer's disease. And, when you look at the shared feature of all the diseases is there's a dysfunction in the vasculature. And so one thing we're trying to do is to look at a particular protein that is known as tissue non-specific alkaline phosphatase. So this protein is localized in the blood-brain barrier, and a lot of historical studies have actually shown that, the activity of this protein actually decreases when you have those diseases, but we don't really know the function yet. So my objective is to study the function of the protein of the blood-brain barrier, and some of the results that we're sort of seeing from my dissertation is that the protein actually plays an important role in maintaining blood-brain barrier integrity. So that's just a small summary of what I'm doing and what I'm about to finish.
Yeah, I'm sure that doesn't do the last 3.5 years justice, but I appreciate it.
Thank you.
Brandon, I'd also love to hear what you did and what you're probably still doing. I mean, we would probably be spending 2 or 3 hours talking about the 100 research articles and book chapters, but I would love to hear what your primary research focus is now, and where you see yourself, especially in the middle of residency and beyond, where you kind of see your career going the next 5 to 10 years.
So going back on my dissertation work, I did primarily looking at repetitive traumatic brain injury, looking at the molecular mechanisms that lead to more chronic neurodegeneration. We found some pretty promising the modulation of endoplasmic reticulum stress targeted pretty early in our rodent model, and found some beneficial behavioral outcomes. What was interesting is we had human brain tissue as well from patients that were post-mortem diagnosed with chronic traumatic encephalopathy. We found that a lot of those molecular pathways were also increased within those brain specimens. So had a pretty robust clinical correlation. So that was the bulk of my PhD work. UF is pretty research driven as well. We have a R25 program, which is a mechanism for continuing to fund residents during research. So I have a pending application. I should be hearing back any day now, but it will be transitioning more into like endovascular, looking at subarachnoid hemorrhage, downstream pathways, similar techniques to what I used during my PhD, but it would be expanding under the mentorship of Dr. Ho, who is the chairman here at UF. So that's the next step. I'm hoping to combine the research interest with the enfolded endovascular fellowship. In terms of a 5-year trajectory, looking to finish up the enfolded endovascular fellowship, my 7th year. Our chief year is 6th year at UF, and then we have some more elective time our 7th year. So my plan would be to complete that fellowship and then probably do an open fellowship after I am done with my training at UF, and then start looking for academic position at that point.
Right. Well, shout out to Dr. Arthur and our episode with him a few weeks ago, talking about all things vascular neurosurgery. But I heard a couple common themes, Dr. Johnson, and especially with their PhD work, a focus on translational and basic research. You're pretty research heavy at BCM. You didn't get a PhD unless you got one in the last week or two that I didn't know about.
I can tell you about that weekend course I took.
Yeah. So who in your mind doesn't probably need to get a PhD? But someone who still is interested in completing research, is it just clinical work that they might be wanting to do? Is it?
So I can kind of give a little bit of an overview of like what does non-PhD research look like in neurosurgery, and as you may imagine, it's very diverse. So there's a number of things that someone can do that is not a PhD. Just because you don't have a PhD doesn't mean you can't do research that provides value and very legitimate results, for the field. So some ways you can go is clinical research, and there's a variety of things that you can do. A lot of people that are busy clinicians do like retrospective research. Some people do meta-analyses. You can just go on and on about the different types of like clinical research you can do. Now there's more formal clinical research, like being in randomized control trials. As a busy clinician, you can have the infrastructure in place, the regulatory structure at your institution to enroll patients in controlled trials, which is very rigorous, but certainly doable without a PhD. I realize I'm probably missing many of these, but I'm just going to give you an overview. So then there's also people that have that want to have their own lab, the clinician scientists, and many of those people actually don't have PhDs. Some do for sure. The people that go that route often have pretty intensive scientific training in their middle years of residency, so that they have a track record of publications and expertise in some sort of science or innovation that they think that they can translate over into a lab. And what's important about that is that someone in academics usually has to give you money and time, which is costly for a department to pursue these things. So you need to have some sort of track record for them to lean on to give you those things, because it's if you're not operating, et cetera, or if another specialty, you're not seeing patients in clinic, you're not maximizing the revenue for the department, et cetera. That's what keeps everyone afloat, right? So pays everyone's salary. So one of the ways to kind of get that legitimacy is to have a PhD, very advanced training that can get you then the projects and the expertise to convince someone when you're looking for jobs, as Brandon will eventually, that not only do they know how to do clinical work, but they also know how to do advanced science training and to invest all these resources in them. And then there's also sort of like clinician investigators that are very heavy into device innovation. They look to create devices and patent them. There's certainly a small group of those. Those don't necessarily considered like hardcore research for the most part, but people do write papers on that work. And then the other pathway is more related to kind of collaborative science. So having a skill that you bring where you can bring tissue from the lab to a scientist that either you work with or in collaboration or works for you. And then you can kind of provide the clinical access to, so for instance, brain tumors or electrophysiology from, EEGs that you're doing intraoperatively, et cetera. And then collaborate with other scientists to have clinically meaningful research that is basic science, has a component of it. And there's probably more I'm missing, but those are a lot of the different routes you can do research that aren't necessarily involved in doing a PhD. But certainly PhDs have a significant, advantage, but they definitely have an increased expertise and kind of legitimacy when it comes to doing that in their practice.
So maybe this is for another day, but talking about like the different, because I know that different residents who are interested in research in different levels or interest levels they have to be thinking about these things pretty early, at least if they want to do something at an academic center, because they have to be able to show, whether it's, figuring out how to get a K award and all these different NIH grants or NSF funding, all these different things that when would someone who maybe doesn't have a PhD should be thinking about and is trying to dabble in certain things? When should they really be thinking about, when should I have my research focus? What do I want to do by the time I'm done with my residency training and fellowship training, and that sort of thing?
Yeah, I think it'd be interesting to hear Brandon's take on this as well. So we're actually putting together a webinar on this. So I'll have more information for you once that's completely, matured. But what I would say is that the earlier the better. Even at the point where you're a medical student and you may want to target particular kind of programs with strong protected time during middle years of residency to spend in the lab. And if you are in a program that has that capabilities, you need to lobby the leadership in your program and find mentors. The earlier the better. That would be my overarching advice.
What do you think, Brandon?
So I agree, earlier the better, but most programs, the protected time is fourth or fifth year. So it does allow some time to start thinking of ideas during junior residency, which is pretty busy from that standpoint. I just want to reiterate that by no means is a PhD required to do very meaningful research. Brian Ho has multiple R01 grants and does not have a PhD, or some of our leading like tumor experts, like doing that collaborative dynamics of having that expertise and then taking some of the specimens to the lab, are also doing some very exciting science too. So there's multiple different avenues, especially throughout the training process for individuals that are interested in research, and it can take so many different forms. I would say to continue to foster that during the entire process. A lot of the K award funding can be built off of projects that were generated during that protected time during 4th or 5th year, and then normally during that 7th year time frame is when starting looking for that next step, whether that's fellowship or whether that's going straight into practice. That's a good time to start looking as well of how to incorporate research into career going forward. So we have a couple junior faculty members that just joined on that are in that process right now. They are submitting K awards. They have a pretty robust research background with several publications, but have developed a portfolio of productivity, but more important are surrounding themselves with appropriate mentorship. And I would say that's probably the most important thing, is finding the appropriate mentors and having someone help propel you forward throughout your career. That's probably the number one thing of being successful down the road.
I would second that. Your mentors, particularly as a surgeon who has their attention divided to a great degree, are extremely important for future success in research.
And that's, yeah, those are all points that, so we actually have a Brain and Spine Report article written by several fabulous folks at a host of different institutions. Kalman Kotlowitz actually at BCM is one of the authors, all MD PhDs. And they talk about, they actually go very detailed at the actual M1 through PhD through residency pathway. So I encourage everyone to take a look at our website and the Brain and Spine Report article there. Jason Chung from UCSF and a couple others are on that article. So you guys are iterating everything that they discussed. For the people who are seriously considering this, a PhD, an MD PhD specifically, through the medical scientist training program, what are the maybe discrete advantages and disadvantages of going that pathway versus a traditional just MD degree? I don't know, Divine, if you want to start that, discuss that first, and any discrete things you can really think about in terms of advantages and disadvantages.
Yeah, so I'll start off with the advantages first, then talk about some disadvantages. So I guess for the MD PhD route, it sort of reminds me a little bit, I mean, I've never been through neurosurgery training, but I've definitely heard a lot of mentors in the field that have talked about it and how rigorous it is. And, you know, it's you train. I think listening to, you know, one of the podcasts you and Dr. Johnson actually had with Siddiq Haq, the Muhammad Ali quote. So it's
Shut up.
Yeah. And I was just like, oh gosh, that podcast, whatever MD PhD student was listening to that day, and you know they're about to do their proposal defense, you probably give them a little bit of confidence for the defense. Because when I sort of think of the MD PhD route, particularly the PhD route, I think that, you know, when you come out from med school and, you know, you're this student that is a type A student, you work your butt off every single day, you do your lectures and you do the stuff. So you get more of a linear curve, whereby, you know, the amount of work you put in equates to your success in med school. So the PhD route for me, I felt was a little bit different. It's a whole different organism on its own, in the sense that no matter how much work you put in, will not always equate what you want out of it. And so it was more of a, I guess, like it's a sine wave curve. Some days are going to be good. Most days are going to be bad. So
for those of you not watching us, he put his finger up and down. That's what a sine wave is.
Yeah. Okay. So when you have things that sort of go in that way, it's mostly builds a sort of resilience in you, whereby you sort of have to look at the way you sort of train as, I think the best analogy I can go with this is like, you could either be a giraffe or a jackal. You could be the jackal that is just like, oh, I got to do something right now. Oh, everything feels, I'm just going crazy and stuff. Or you could be the giraffe in a sense that sticks his head out of the safari and watches and see, okay, what's the best path out of this for me? So that, I feel like that's one of the advantages. You sort of get that if you're interested in neurosurgery, you sort of build this resilience from an earlier standpoint. And the other thing too is you sort of get used to the long training, because you're doing this for 8 to however years your PhD takes you to get done. So you sort of get used to that long training of being in the PhD program, MD-PhD program, that you would get in neurosurgery. Not making a comparison between the two, but it's just the rigor that it takes to get to that point. And you sort of get, again, going back to the resilience, where it's like you're not necessarily focused on a static finish line. You understand that, even though you and a set of people started med school together, like at the end of the day, you all have like different finish lines that's like different for everyone else. So it sort of builds up your mindset for that. And I guess like one minor thing that I would sort of add to the MD PhD too, like which is very minor but also important. It also alleviates the financial burden you would have to worry about if you were later on in residency. A minor point is it should be the defining factor to do an MD PhD, but it's something that is also important.
Brandon, is there anything you'd like to add off of what David Attenborough said? He's talking about jackals and giraffes, but I don't know if you can add anything there.
Excellent points. I think the resiliency statement is important, because that is definitely what's needed for neurosurgery training. There, like the PhD time frame, there will be good days and bad days there too. So it's just constantly continuing to move along in the process. PhD gives you a different thought process. It's a lot of independent thinking, really delving down into one topic and asking critical questions. So you're developing a true level of expertise in that field. And by the time you're done with that, for whatever that topic is, you should be an expert in that topic after that PhD training. There's a lot of transitions during the process. So it's rejoining medical school, starting out being an intern again. So it's a lot of, you made it to one pinnacle, but you're instantly restarting the process. But it's good for the overall training. I think it helps keep you humble during the process, realizing that there is a lot to learn. There's a lot that we don't know already. And as was mentioned, that resiliency is a critical determinant of defining a good neurosurgeon as they advance throughout their career.
Dr. Johnson, we hear resilience and grit almost in every episode. I know you guys did that with a webinar, but we might need to do a podcast on that too.
Yeah.
So Brandon, as a follow-up, what are some discrete disadvantages? You guys talked about, obviously being able to think about things in different ways, think more independently, more as a scientist, more potentially data-driven. And then also some of the lifestyle advantages. What are some of the disadvantages, whether it's career-related, research-related, anything?
So there's a lot of transitions. There's a lot of gaps in training too. You make it through the first 2 years of medical school, have a pretty good clinical knowledge base at that point. Going into third year, So a lot of catch up that you have to initiate in during the clinical training portions. Still playing catch up into early part of residency too, just because there's a large gap between when you had neuroanatomy compared to your colleagues. So that would probably be the main disadvantage, not insurmountable by any means, but definitely a challenge at that point. I would say another thing that you have to consider is that a lot of your friends will be already well advanced into their careers in both sides of things. Most of my friends from medical school are now attendings and well into their clinical careers. Same for the colleague I did my PhD with. He's advanced through postdoc, already has a faculty position as well. So they are career-wise a lot further ahead of where I am right now. That being said, I would not trade things. I am very happy with the decision, even though it's a very long journey. I think it ultimately will provide a lot of satisfaction and opportunity to truly help patients.
That's great. That's really great. So it sounds like you do it again, if you could do it again. Yeah, that's always a good indicator of, how happy you are in something. Divine, you were just talking it up, so I'd love to hear some disadvantages.
Yeah, I guess I talked a lot about the advantages and I totally forgot about.
No, it's okay. It's okay. That's good. It means you're passionate.
Yeah. I'm gonna agree with Brandon on every single thing he actually just said. I think, as someone that is transitioning back now, I am trying to, go back and study most of the preclinical year stuff, and also then do some of the third and fourth year stuff. And I feel like you sort of lose your not necessarily the knowledge you learned from the first 2 years, but actually seeing patients again, especially if your program doesn't really have anything designed for you guys to rotate with preceptors or anything like that. So, and, just to sort of buttress on what Brandon just said, to, you sort of see everyone progressing. But I think for me, like, I've always just been like fine with that in general, because I've always just had the perception that I've never been on the same path as everyone else. They're gonna progress into different specialties anyway. So I actually even see that as an advantage for me when I go back to the clinical years, that I have people that started off with me. They can, perhaps point me into the right direction. Even going back into the third and fourth years, but also in clinic in what I'm not doing right. And I feel like they would be more likely to assist me in some of the things that maybe I'm going to apply to residency, and like point me towards the right direction. So I see that as a plus, and not necessarily like a disadvantage for me, because I've just never I've always had this perception that we learn a different way. We learn different ways, so we can't finish the same way too, and that's just my own perception of that.
So if you're interested in neuroscience and neurosurgery in college, especially, it would probably behoove you to really focus your MD, PhD applications on places that have a neurosurgery department, and not just because you would have the ability to find, neurosurgeons to be part of your thesis committee or as a PI or anything like that, but also because when you're during that training, you could still be a part of the neurosurgery department and still be getting some of that clinical exposure. Is that, in theory, that sounds good? Is that real, Divine? I mean, do you think that that's real, or is that something that I'm totally saying out of naivety?
I mean, like, I don't know what other organ is more cooler than the brain. So I think I'm good. So like, that's always just been my own interest. I've always had a deep fascination for, the complexity of the brain. I definitely agree with what you're saying. I think that, if you're interested in neurosurgery, me personally, I felt like what better way to understand the brain than have a PhD in neuroscience, especially when we don't really know much about this organ.
Right.
So yeah, I would definitely say that. And that's something I'm actually doing right now. So most of my PhD work has been on like basic neuroscience, and something I'm trying to do in my last semester is to start getting most of the clinical neurosurgery stuff done, and that's something I also want to do in my third year too. To kind of sort of see, you know, like the whole point of having this PhD is to be bench to bedside. I'm in the process of starting to see if I can maybe start at an early stage to integrate the two, to see how, you know, maybe what I've learned, how can I apply those skills now that I've gained in my PhD to do clinical research. So that's mostly what I'm focusing on for my transition year.
That's great.
I can throw in a couple of quick questions to the crowd. So I've obviously graduated from residency, and so I've seen the fate of some of my friends who are PhDs. And one thing I would say is that they are clearly outclassed the rank and file other residents that aren't PhD trained when it comes to research and science within residency. I mean, I think that they have a distinct advantage in that realm for sure, as you would expect they would, but they most certainly do. Postgraduate, I want to ask the guys two questions. A handful of people I've seen that have PhDs actually go into practice and choose not to do science after all that training. And then I've heard the criticism, I haven't actually seen this in full force, the criticism or caution, maybe is a better word, the caution that by the time you've gone all the way through a long nursery residency and potentially a fellowship, the cutting edge science you may have done in medical school is now, you know, old techniques. And so if you have to make sure you have the ability to kind of keep up to date during your middle year research with your original research, for that kind of to translate through to a potentially postgraduate, you know, career in that subfield that you've studied your PhD in. I was just curious to hear you guys' thoughts about one or both of those issues I've run across talking to people.
So excellent points. I've had several colleagues that have faced that dilemma as well. I would definitely say the techniques will have changed by the time of completion of residency. I think the benefit of doing a hands-on specialty like neurosurgery is that we are constantly learning on a daily basis. Our field's constantly changing too, so I think we are very capable of learning new skills and techniques. So yes, it's a hurdle, but I don't think it's something that we can't handle. I also want to iterate the value of collaboration. Especially doing the large clinical trials or even pushing basic science forward, can't be done by an individual. It has to be done by a team. And I've realized that over and over again, it's really, science is more about teamwork, collaboration, really getting multiple talented people together from different disciplines and backgrounds and really trying to push things forward together. So a big bulk of a lot of the research I'm doing now is through collaborations and incorporating younger trainees. So I'm very big into mentorship. I have multiple medical students, MD-PhD students that I'm mentoring as well, but also constantly seeking mentors. I think throughout our training, we always need mentors, both from clinical and research standpoint. And I think that is the key of becoming successful, like broaching those hurdles, trying to find the right team that can tackle the more difficult questions and develop some new expertise along the way in terms of skill sets.
And I want to say, I was just being a little bit of a devil's advocate. I've heard these things. I was just curious to hear your response to them. I think you're absolutely right. I think it's doable, and there are obviously many successful people that are extremely, you know, successful at transitioning their expertise through their training and into a lab postgraduate from residency. I was just curious to hear what your thoughts were. So,
Dr. Johnson, I really wanted to maybe take a step back. And so, Brandon, you said you're mentoring some MD-PhD students. You've recognized that that's important. I certainly understand it's important, typically as a mentee, being a mentee in that relationship. What are, you know, as me being generic medical student, maybe early resident, what are some research, what are a couple of things about research that you really wish neurosurgery trainees, neurosurgeons knew earlier in their training, and maybe was a greater focus of medical school as well as organizations like YNC, MSNTC, AANS, CNS, some of these, NREF, obviously, some of these places, some of these organizations that are in the business of providing resources and skills training and mentorship in research. I don't know if Brandon, if you want to tackle that first, I'd love to hear your thoughts.
So excellent question. Research involves a lot of writing, and we really don't get that much exposure during the process of our medical training. There's formulating a paper, a scientific idea, and then taking it to publication format. I think that's very valuable. I try to mentor the medical students that I'm working with, have them be the initial first author on the paper, really try to coach them and refine their writing skill, provide feedback in that regards. On that same line, grant writing is very much of a business pitch, and we get very little business exposure during our medical training as well. So it's learning more about marketing and how to take a scientific idea and then sell it to a broader audience. I think that is definitely a learned skill set that I'm still trying to figure out. I think taking a lot of examples from the business world and having some more marketing expertise come in to really say this is how you simplify concepts and really sell them to a broader audience is absolutely crucial, because ultimately you can do the most exciting research in the world, but if you can't get it out to a broader audience, then it will have no clinical impact.
That's great. Devine, did you have any other, I mean, you can agree with him. I certainly agree. I'm trying to learn some of just writing research. There are a couple books, like there's a book that it's on writing well. I always forget the author. That's helped me, but I don't know if Devine, if you want to expand on what he said, as well as maybe some resources that you've used to improve your research skills training and writing and these sorts of things.
Yeah. So for me, I guess my PI sort of, she got me early in the writing process. Literally, once I joined the MDPhD program, the first thing I had to do was to do a literature review on the topic area. So it sort of gets you to like really know about the niche you're about to sort of delve into. So the first thing you sort of want to do before you start writing anything is make sure you know what's already been done by that. So literature review was a good idea. And another thing is that she also like emphasizes going to meetings. So like I remember like I think 2 years ago I probably went to like 10 meetings in a year. And because what Brandon sort of said with the grant, you can do your research, but if you can't talk about it or explain it to someone else, then it's not that impactful. So you have to be able to go out there and talk about what you're doing. And it's also important to network so you can get that collaborative skill where you meet people and you talk, and then you can get phone numbers. You're like, oh, you guys use this particular cell line. Maybe I could use some of this. We've been trying to get this, and I've made some good collaborations actually from going to some of the physician scientists meetings, APSA being one of the more famous ones. So those are some avenues to or resources that sort of make you a better scientist. And for me, I also think that something Brandon sort of said earlier is recognizing that research is a teamwork. It's not an individual's success, and I think that could also be applied to medicine too, because one of the things that we sort of practice here at the BVU School of Medicine, and Brandon too can attest to this, is like it's more of when we don't necessarily just like celebrate when an individual in the class succeeds, but we love to succeed as a team. And you can also see that in neurosurgery too, because like if one guy is just succeeding in your program, or one resident is succeeding in your program, then that's not a good program. It's like you guys want to pull yourself along together, and that's what makes a strong team. So reading a lot of books also helps to expand your skills with writing. But you you can love research, but if you can't write it down to get your research funded, you're pretty much still at the same ground zero, because funding is an important part of research.
Would throw in there one additional thing, having sorry, I hope you're.
Oh yeah.
Yeah, sorry, I thought you were done. I threw in there one additional thing, which is something Brandon brought up earlier, which is that like as you move through the process, you are kind of an amalgamation of your research mentors. I think that you cannot just de novo think all these skills up. You have to really rely on them and collaboration, even if it's not a direct research mentor like is formalized in PhDs. Collaborative mentors that help you review your grants, provide a secondary skill set, like a bioengineering skill set when you have the clinical skill set, et cetera, is extremely important skill to have. And I would say for people that are interested in research, even if it's not formalized in a PhD program, identifying mentors and working under someone who is themselves very successful and skilled will help you learn those skills.
So Divine, my real last technical question is, it was I guess now 6 years ago, but where are some places that people, whether it's undergraduates or people who have wanting to make a career change, where can they find good information about how to become an MD PhD student?
Yeah, so I would definitely, if your school has an MD PhD program or an MSTP program, you can start from there. For me, where I sort of started from was with Brandon. He was already in the MD PhD program. He was pretty successful with being in the MD PhD program. So I was like, okay, I this is something that I'm interested in. So I found a mentor and someone that could sort of guide me through the process and, sit with me and talk and discuss if this was truly what I wanted to do. Some other institutions tend to have summer research programs. And that was also a useful opportunity for me to like sort of, look at stuff that I've actually studied in med school and sort of apply it in a mouse model and see if I could, see the disease itself in a different model. And so those sort of programs are important in sort of getting you interested in research and truly figuring out if this is what you want to do. It's a 6 to 8 week programs. So it's not, you're not getting like an in-depth research opportunity, but it's very important because it could literally be the thing that hits the light bulb for you. Because that was my aha moment. And, and like I mentioned from the introduction, like, after how much I really, really sucked at doing electrophys, you would think I would never do this anymore. But for me, I think that, just seeing it, and I think I've gotten this question so much. So would you, if you have to pick one or the other, and I think this was going back to Dr. Johnston's question on trying to manage both being an MD, PhD, and being a physician. If you have to pick one or the other, which one would you pick? And for me, it starts again from that same question. What really led me to the PhD was medicine. So both of them are connected. And I think one of the things that most med school students tend to think is that, I just want to be a doctor and not really do the research part. But you have to understand from an earlier point that without research, there is no medicine, and without medicine, there is no research. So we sort of have to get that from an early mind frame, and that, this are connected. But I can buttress the part again by saying that, finding a mentor, someone that can guide you through the process, that is the most important resource you can get. Because if you still don't understand how you can't navigate this system or this terrain alone on your own, they're going to guide you towards meetings, towards networking with people, or they might even guide you in the right direction for you to find a mentor that might be more suitable for you.
Wow. Well, like with all the guests that we bring on here, I'm excited to call you guys colleagues here soon in residency. Dr. Johnston, did you have anything that you would like to conclude with, or other questions that we haven't gotten into yet that we should have?
No, I think we covered a lot of the high points. I'm very curious to have if Brandon and Divine give us both their parting thoughts. Like maybe it would be a plea for people to do a PhD, or who the PhD is fits best for. Any kind of advice to help guide people when they're thinking about making that decision, PhD or just regular medicine route. I mean, what kind of 2 or 3 line advice would you have for someone making that choice? Like who should do it, who shouldn't?
So I think if you know for sure that you want to go into neurosurgery, going into medical school. I think it's a great avenue. I did my PhD in 3 years, so it added a little bit of time, but not an extraordinary amount of time. I think the number one important thing that it provided was networking and mentorship, and more importantly, colleagues and friends that I will have the rest of my career. Big reason why I ended up at the residency program that I did. I did some a big project with the chief resident that was at UF at that time, and we really developed a good connection. So I think again, it all comes down to people. I think the research is exciting. Neurosurgery is a field that pushes things forward. I think it's one of the most, if not the, at the ultimate level of pushing scientific discovery. So I'm just excited for what the field has to bring in the future, and also to get to meet some of the rising stars that are coming up through the training regimen as well.
How about Divine? Anything you think you can advice you can tell someone that's thinking, should I do PhD or just go straight to medical school if they're at that inflection point? Who should choose the PhD?
Yeah, so for me, I think that it's going to be a choice where you sort of have to look at not necessarily where you're at, but where you want to be, and not choosing one or the other is not necessarily a wrong or right path, because the PhD for me was a decision that I felt that was important for me to start that early foundational research aspect where I could start networking earlier on, and also building the skills needed at an early stage in my career. But that doesn't necessarily mean that, if you start later on in your career, you're not still going to be a fantastic physician scientist. So if you're looking for something, and Brandon sort of mentioned this, research and neurosurgery, probably one of the only specialties that I've seen that are very closely knit. You can probably do a survey of the applicants applying to neurosurgery, and I bet you most of them, 90-something% of them, will have at least one publication, and that goes to show that close relationship. So if it's something that you're particularly interested, if you're interested in learning, getting a strong foundation in grant writing, and very curious about basic science research at an earlier standpoint, then the PhD is definitely for you. If you're more so interested in the clinical aspect, there are other programs that you can do, clinical translational stuff that are 2 years or 1 year post-sophomore fellowships that are also important so that you could take. But if you like that one-on-one mentorship with someone that is either in their early career phase or in their late career phase, that can mentor you when you're still just starting up as a student, then that's the PhD would be the route that's best for you.
That's excellent. Thank you guys for answering that question.
Thank you.
Our guests have been Brandon Lucke-Wold and Nwafor. Brandon, thank you so much for coming on.
Thank you so much for having us.
Yeah, this was fun.
All right. Thanks, guys. Hey, if you enjoyed this episode, please subscribe, follow, and leave a comment in Spotify, Apple Podcasts, or wherever you get your audio content. Make sure to follow MSNTC and the YNC on Twitter, Facebook, and Instagram. And check out our webpage at neurosurgerytraining.org/TNJ, where you can find other episodes and links and resources related to today's conversation. Be sure to check out the YNC's webinar series and visit their webpage on AANS.org. If you have comments or ideas for episodes, or would like to join us to talk about anything neurosurgery related, our email address is tnjpodcast@neurosurgerytraining.org. We'd love to hear from you. Finally, I'd like to thank Matt Rosenthal, one of our fantastic MSNTC volunteers, for helping with the editing and processing, and also thank all the fabulous people involved in this project. Have a great day, and we look forward to next time.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.